If you have just been diagnosed with diabetes, high blood pressure, high cholesterol, or any other lifestyle-related chronic diseases, I want to encourage you to be the tortoise and focus on three things. What do you think I mean by that? Hi, I'm Dr. Chan. Welcome to the Habits Pharmacy. Here, habits are medicine, powerful medicine, intentionally prescribed to prevent, control, and combat lifestyle-related chronic diseases. And in this episode of the Habits Pharmacy, I want to talk about what a person who is newly diagnosed with a lifestyle-related chronic condition should do and should focus on. But before that, I would like to share something that I often see from my experience as a medical doctor focused on training and coaching people to change their lifestyle habits to better control their chronic conditions. And that is how people tend to react to the news of being newly diagnosed with diabetes, hypertension, high cholesterol, or any other chronic condition. They tend to fall into two groups. One group would turn into chicken litters, or in Singapore, we would say kanchong spiders. And another group would choose to be ostriches. The chicken litters or the kanchong spiders would become all panicky and they would dive into extensive research on YouTube, join Facebook groups, searching and asking for recommendations for supplements, for superfoods or herbs or food hacks that people recommend will help with their condition. They will end up doing everything and anything randomly and eventually actually achieving nothing. Another group would choose to be ostriches, burying their heads in the sand, thinking that if they ignore the problem, not think about the problem, not confront the problem, they would not be stressed by the problem. The problem being the new diagnosis of their diabetes or high blood pressure or whatever that might be, a lifestyle-related chronic disease. Even when they know that the problem doesn't go away simply by ignoring it, that would be their response mechanism. So some will become kanchong spiders or the chicken litters, while others would choose to be the escapist ostriches. I would suggest that if you're newly diagnosed with diabetes or any other lifestyle-related chronic diseases, don't choose either of them. Don't be a panicky chicken litter or kanchong spider. Also, don't be an escapist ostrich. I would recommend that you choose to be the tortoise in the famous The Tortoise and the Hare story that all of us are very familiar with. Just like the tortoise in the story, you focus on the goal, take steps, slow and steady steps towards your goal, calm and determined towards your destination, one step at a time. And that is the best mindset, the best emotional state to have, to respond to a new diagnosis of a chronic condition such as diabetes, hypertension, or other similar conditions. Not panicky like a chicken litter or kanchong spider, not complacent, not going into denial or escapism like an ostrich burying its head in the sand, but be like the tortoise in the Tortoise and the Hare story, determined but calm and steady, taking steps forward in the right direction, one step at a time, one day at a time. If you have just received the news of a diagnosis of lifestyle-related condition such as diabetes, I would strongly recommend that you focus on three things. On top of whatever your doctor had prescribed or recommended to you, continue to follow your doctor's instruction. Continue to work closely with your doctor. But I want you to also focus on three things. Number one, focus on improving your lifestyle habits. Don't focus on looking for the best supplement, the best superfood, the best medicinal herbs, the best 23-day, 90-day diet plan that promoters promise will make your disease go away. Don't turn to whatever detox plans or food hacks recommended by your well-meaning friends. Instead, focus on improving your lifestyle habits. Because we are talking about lifestyle-related chronic diseases here, where lifestyle habits play a role. So focus there. Focus on dealing with the root or at least a significant contributor to the problem. Number two, start with the obvious. The obvious aspects of the lifestyle habits that you know are clearly good to improve for your condition, where you have obvious room for improvement. From my years of experience helping and coaching patients with lifestyle-related chronic diseases, I have yet to encounter anyone who come to me with a perfect 10 upon 10 lifestyle, where no aspects of his or her lifestyle and eating habits have any more room for improvement. Nobody I know have a 10 upon 10, 100% perfect lifestyle with zero room for improvement. There will always be areas that can be improved. Even areas that they have already improved, there's still room for further improvement. And often it is even obvious. For example, of the patients with diabetes that come to me for one-to-one coaching to get my help to improve their diets, to better control their blood sugar, more than half of them still have significant room for improvement in the obvious area of intake of added sugar in their diet. All of them know that it is obviously contributing to their problem, the area of added sugar in their diet. And it is obvious that it would help them if they improve that. And it is also obvious that they still have room for improvement. But yet, they have not done anything to change and improve that. Or they still have further room for improvement, but they stopped trying. So I'm going to say the obvious. The obvious still need to be said. And that is start with the obvious. That is number 2. Start with the obvious areas in your lifestyle and diet that needed improving. And number 3, do it well. Keep making it better and better. 卖走卖走，爱走做水水. When attempting to change and improve any aspects of your lifestyle and eating habits, it is okay to fail. It is even normal to fail. Whenever you try to change or improve anything, especially something as difficult as trying to change lifestyle and eating habits that have been hardwired into you for decades, for tens of years, from the time you have the ability to make choices, lifestyle choices on your own. So it is not easy. It is okay to fail. It is even normal to fail. So tell yourself when embarking on lifestyle change that it is okay to fail. But it is not okay not to continue to try to make it better and better and better. Let me share with you a very common situation, a very common experience that I would have with patients that I coach. Many patients with diabetes would say to me, Doctor, ever since I got diagnosed with diabetes 5 years ago, I have reduced my sugar intake. And right now, for this past 5 years, I'm only adding 2 teaspoons of sugar in my morning coffee instead of my usual 4 teaspoons that I used to do before that 5 years ago. And I'll look at them and say, and since you made that switch from cutting down from 4 teaspoons of sugar in your coffee to only 2 teaspoons 5 years ago, have you cut that down even more since? Have you become even better in this particular aspect of your diet since? And they will look at me perplexed because to them, cutting down from 4 teaspoons to 2 teaspoons of sugar in their coffee, that was an achievement and that was good enough. And I do not deny that. It is well done. It is an achievement. It is good. But I will still say to them, when it comes to something like cutting down on sugar that you choose to add to your cup of coffee, which is discretionary and easily within your control, cutting down from 4 teaspoons of sugar to 2 teaspoons of sugar, it is very good. But it can still be better, which is no added sugar, 0 added sugar in your coffee. To my Singaporean patients, I would always say, Siu Tai is merely a milestone. Kosong is still your final destination, meaning that cutting down to 2 teaspoons of sugar per cup of coffee is a great milestone. But getting to a habit of learning to enjoy your coffee without the need of any added sugar, with 0 added sugar, should still remain your final destination, no matter how long you take to get there. Siu Tai is merely a milestone. Kosong is still the destination. Reduced sugar is merely a milestone. No sugar in drinks is still your final destination, no matter how long you take to get there. Whenever I conduct habits as medicine training or workshops, I can often be found saying, anything worth doing is worth doing absolutely, resolutely, consistently, persistently. 卖走卖走，爱走做水水。If something is important enough, it is certainly worth doing and trying until we eventually succeed in being the best that we can be. And making lifestyle habits changes to tackle lifestyle-related chronic diseases is one of them. So that is number 3. Focus on doing it well. Do it better. So that is what I mean when I said at the beginning of this episode of the Habits Pharmacy, that if you have just been diagnosed with diabetes, hypertension, or any lifestyle-related chronic diseases, Be the tortoise, not a panicky chicken little or kanchong spider, and neither an escapist ostrich in denial. But the tortoise who is calm, determined, and always taking slow and steady steps in the right direction towards your final goal of being able to overcome, able to adequately, optimally control your chronic disease. And focus on three things. Focus on improving your lifestyle habits. Start with the obvious and do it well, and keep aiming to do better and better. And if you have diabetes, and if you want to build a strong foundation of understanding diabetes reversal, I have a structured online learning program called Reversing Type 2 Diabetes, the Essential Basics. If you are keen to find out more, the link should be somewhere in the description or notes of this episode, depending on where you are watching or listening to this podcast. Go to my websites, thehabitsdoctor.com or thehabitspharmacy.com. You should find the info there. I hope you have enjoyed this episode of the Habits Pharmacy podcast and found it useful. I am Dr. Chan. Let your habits be your medicine to combat lifestyle-related chronic diseases. See you at the next episode. And until then, eat well and be well.